Yeah. Prevention and treat. What is a pulmonary embolus? So what is a pulmonary embolus? It is obstruction of the pulmonary artery by blood clot, air, or fat. Or septic tissue, or just about anything. Or amniotic fluid.
What is septic thrombus?
A septic thrombus means that you have got an infection in your blood system of crud, and it's broken free.
So it would be like a bunch of white lines.
So we want your blood around necrosed, thrombus, like bacteria, or the inside of your blood vessel dies and is sloughed off just like a scab on the inside. Yeah, they're pretty nasty. Most commonly, though, they happen from blood clots in the legs. Okay, that's the most common place for them to come from. So what happens with the pulmonary embolus is, now blood goes to the lungs from the right side of the heart, right? So we have veins in our legs. Remember, the capillaries the arteries get smaller and smaller and smaller, and they get to the capillary bed, and then they're tiny, and they get bigger and bigger and bigger and bigger and bigger. So you can form a clot in your lower extremities. He's just kind of floating along, being a clot, not causing any trouble. Going on up the vena cava. Just had a brain thing. Inferior vena cava, and goes on into the right side of the heart. Goes into the atrium, not causing any trouble, it's just there being a clot. Gets into the right ventricle, no trouble, being a clot, pops into the lung, and all of a sudden, he hits a pulmonary vessel. Depending upon how big that clot is, depends upon how much of the lung is obstructed. Okay? So, a clot in the lower extremities is going to lodge in the lungs. Somewhere. Okay?
Is there a time that if you get to the heart, that it affects the heart?
It would have to be awfully big. But remember, the coronary circulation comes off of the left side of the heart, not the right. Okay, because the heart receives oxygen in blood. So it's going to, clot from the venous system is going to lodge in the lungs. Okay?
It wouldn't ever lodge in the right side of the
No,
heart.
because the circulation for the right side of the heart comes from the left side of the heart. Okay? The heart is oxygenated first.
Circulation from the right side of the heart? Does that not come from
No, circulation, no. The heart is oxygen. You're not thinking about, we're not talking about circulation, we're talking about venous return. Okay, venous return does not go to the heart. Venous return, does not go into the heart circulatory system. We'll have to talk about this later. If y'all aren't clear on cardiac circulation, okay?
What was her question?
Her question was, would a blood clot from the leg ever lodge in the heart? In the right side of the heart? No.
She means inside the ventricular atrium.
No, and is that what you mean, inside the ventricle atrium? Not hard. Now, if you get AFib or something like that, you might have clot formation. Okay, that's a kind of a different thing. And you can have, with AFib, you can have a clot thrown from the left side of the heart into the heart. Yes.
Okay.
And we're talking, okay, you see what I'm talking about here? Right. Coronary circulation is oxygen. You were just talking about the actual physical vessel. Right. Okay, it would be, very unlikely that a clot that forms it's not going to be big enough to block off that the whole atrium, right? No, but you could with AFib form clots that could affect the coronary circulation. But we're talking about pulmonary embolus right now. Okay, so when do you think we might get a fat embolus?
Cholesterol inside of the
broken bones, broken long bones. Remember that long bones have got, from your anatomy and physiology, marrow is where we make all of our blood cells, right? And marrow there's red marrow and yellow marrow, and yellow marrow's fat, and the long bones have great circulation, okay? And it's very easy, if you have a fractured long bone, to throw a fat embolus. Okay? And then, of course, air. We've all seen the TV thing where the air comes towards the patient from the IV line. The patient actually takes a good bit of air, but a lot of air from central venous lines, central lines and things like that, if you're not careful, you can cause an airway patient. Okay? Now, tiny bubbles of air and IV lines, those are absorbed pretty quickly because they're gas. Air is just a gas, okay? So those are the three main forms of embolus. What happens is there's no blood supply, and so that ventilation perfusion ratio changes, and then once there's no blood supply, there's no gas exchange, okay? And then what happens on top of that is we start to get inflammation, okay? As soon as there's no blood supply, the body's going, what's going on here, what's going on here? We get inflamed, and then we have dilation of the regional blood vessels and constriction of the bronchioles, and the inflammation just compounds itself. And so you have massive, basically lung death is what happens, okay? Because you've got bronchioles constrict, there's more pulmonary vascular resistance, which raises the arterial pulmonary pressure, which raises the right ventricular workload because the heart's still trying to pump that blood through, and it can't. And then you get a ventilation perfusion imbalance, and then you get right ventricular failure, and then you die. Unless we do something, okay? You get shock, and then you die. So here are the risk factors. Venous stasis. How many of you heard that people now on airplanes, you know, people who've gotten off an airplane after a long flight and they had a clot, they died? Okay? What's up? You thinking of something?
Who? I did.
Erica, I was looking.
Oh, no, I said that's silence.
I know. You know, you're going on a vacation, and all of a sudden you get out of the plane and you throw a clot. Yes.
With lung sounds, with this, would you hear crackles, I presume? What would you hear if you're listening to
If you're going into
someone's lung?
pulmonary edema, it just sounds like they're drowning. But at that point, I hope you've got them on a ventilator. It's just.
But I mean, if we're suspecting this, and you're listening to the lungs, I mean, are you going to hear crackles, or you're not going to?
It's going to happen so fast, you're not going to be spending time listening to the lungs. It's not like with a pneumonia where you're assessing.
Okay.
Looking, I mean, it's happening so fast.
Okay.
It's an emergency. It's an emergency. Remember, the brain is dead in 4 to 6 minutes. It's an emergency, okay? And it's an inflammatory response that happens so fast you can hardly imagine how fast it can happen.
My grandma died from it within 8 minutes.
You can, yeah, pretty quickly. Pretty quickly. Yeah. With a pulmonary embolism, yeah, it's fast. I mean, it either kills you or it doesn't, and it kills you fast. Okay. So you can get it from venous stasis, hypercoagulability. Another one of my favorite words. What do you think causes that? What are some conditions that can cause lungs are weak? Okay. All right. Let me go on. So pregnancy, obesity, oral contraceptives, and constrictive clothing. Who'd have thought that tight jeans could cause you to have blood clots in your legs?
You'd think they'd look like Ted hose.
You would, except that where they constricted the femoral.
Yeah,
Okay.
they're tight in the wrong spot.
Okay, the wrong spot. Previous history of thrombophlebitis. So if you have somebody, so when you're doing a history, anybody in your family ever have blood clots? That's an important question. Okay.
How often does birth control have that side effect?
Not often, but it does happen in significant. Not as much with the newer ones because they're very low dose. With older ones, it was fairly common. Statistically common. And if it's you, it's 100%. 1 second. I'm sorry, Kelly?
You've got previous history of thrombophlebitis. Is that the patient or is that the family?
The patient or the family. If there's a family history of thrombophlebitis, that could be significant. But particularly if the family's had it. I mean, the patient's had it before. Yes. Yes, Jessica.
Doesn't, if you smoke and use oral contraceptives, doesn't it significantly increase your risk?
Significantly, particularly after the age of 35. Yeah. Smokers tend to have higher hemoglobins and tend to be a little dehydrated. Okay? So how do we prevent it as nurses? We teach clients exercises to avoid venous stasis. I've been moving around up here because I don't like standing still. Contracting the leg muscle.